As elected leaders and health experts plead with the public to get vaccinated, officials are still having trouble reaching those who are hesitant to roll up their sleeves. Now, part of the problem is widely circulating anti-vax rhetoric. KIMT News 3's Anthony Monzon has a look at the history behind vaccine opposition.
We are going to continue to develop variants as long as we have unvaccinated people who are getting infected.
Mayo Clinic expert Dr. Gregory Poland depicting a shift in the ever-evolving battle against coronavirus.
We have let this get to a point where we can no longer talk about we're going to eliminate the pandemic. We're going to now be transitioning scientifically into what does it mean to live with this virus as we do with influenza.
Vaccination is ultimately our way out of this, Dr. Poland says, but getting everyone on board is anything but easy.
Convincing people of the efficacy and safety of vaccine has been, as it is with every vaccine, a monumental task.
Poland is one of several experts who have combed the history books in search of the roots of anti-vax attitudes. Their conclusion, vaccine opposition came hand in hand with the first vaccines.
They are all attended by these same kind of myths, misinformation, and disinformation.
In a 2011 review, Poland writes anti-vaccine thinking died down between the 1940s and early 80s, in part because of a boom in vaccine science and public awareness of infectious disease outbreaks. But with fewer highly visible outbreaks, more vaccines, and widespread dissemination of poor science and anecdotal claims of harm from vaccines, anti-vax thinking flourished again in the 70s. Today, Dr. Poland says COVID vaccines are the most studied we've ever had in the U.S., unparalleled in scrutiny and urgency to understand them.
At this point, to say that in the face of a raging pandemic with a highly transmissible variant, to say we're going to hold off to see about safety is to model really poor decision making in my mind, very poor discernment, and we want to do better for that with the next generation.
With experts detecting risks as low as 2 to 4 per million doses, Poland says there's a simple choice before everyone.
Choose your risk. That's what it boils down to for every decision we make in life is risk and benefit.
In Rochester, Anthony Monzon, KIMT News 3.
Even before the pandemic in 2019, the World Health Organization named vaccine hesitancy as one of the 10 largest threats to global health.